So the question is, why did you make a neckWRAP, doc? And I want to remind you that it's not as simple as that. What is a neckWRAP? neckWRAP is an advanced dual chip LED technology. We use 3 separate wavelengths simultaneously. So red, infrared, and higher infrared. And the reason why is because we need to really remember that these cerebral arteries start extracranially. That means that the blood supply to the brain isn't in the brain, it starts in the neck. Extracranial cerebral arteries. We got the common carotids, the vertebral arteries, and these scenarios here. So pay attention. When you have, and you understand that the blood supply to the brain comes through the neck, it kind of changes your perspective on why and what you need to do. Look at the size of the arteries in the neck and look at them as they progress into the brain. That they get smaller and finer. And they really perfuse the deep parts of the brain, but they're getting very small, these perforating arterioles. So they go from bigger to smaller to smaller to smaller. And even the ones on the surface. So you can see that these big arteries in the neck get smaller and perfuse all the areas of the brain. But in photobiomodulation, we can open these arteries. We can vasodilate these arteries, but they're the small arteries. And really what we want to do is vasodilate the big brain arteries, the big brain blood supply. It's the difference between opening them up a little spigot of water or a large pipe. And that's really what we're doing. And I really covered this in my book, My Brain Matters. As I said, it's 1,000 references, took 5 years to make. And Dr. Jack DeLatour really has been banging the symbols on this thing. The cardiovascular risk factors promote brain hypoperfusion, leading to cognitive decline and dementia. So vascular risk factors for Alzheimer's disease and vascular dementia are the same as cerebral vascular risk factors. Strokes, so aging, diabetes, arrhythmia, anything that affects the heart, the blood vessels will affect the brain. So these risk factors here alter cerebral hemodynamics, blood get to the brain. You have a chronic cerebral hypoperfusion, and that kind of really slows down the brain's ability to work, cognitive decline or Alzheimer's disease or brain fog or whatever you want to call it. The hypothetical thing that he put together is that cardiovascular risk factors, things that slow down the blood get into the brain, disturbs the brain's ability to pump, to work, hemodynamics, cerebral hypoperfusion. You don't get the juice up there. You don't get the blood, the oxygen. You have increase in this inability to push out the waste products too. But basically, you're slowing down the brain by gumming up the carburetor. So global brain hypoperfusion and oxygenation in mild cognitive impairment. We understand that as you get older, your nitric oxide bioavailability goes down, right? Young people have a lot of ability to increase their circulation. And as you get older, the risk factors like hypertension, high blood pressure, maybe this, maybe inflammation, reduce the circulation of the brain. And that creates this low perfusion in the brain. And if we look at the normal brain, we'll have some perfusion. If we look at an Alzheimer's brain, we have hypoperfusion. So we can't get the blood in there. So the point is carotid stiffness, these external arteries are associated with brain amyloid plaque burden in cognitive impairment. So if you did photobiomodulation therapy on the extracranial cerebral arteries or the brain arteries, the arterial circulation of the brain starts in the neck, you're going to have a much better chance of increasing nitric oxide release and increasing that blood flow to the brain, rather than just sitting up here and trying to suck it through a small straw. So the bottom line is the photobiomodulation will increase vascular reactivity, increase blood flow, and allow to have more blood flow to the brain. They expand these arteries, in the neck. And then if you did it in the head too, you would expand it even more. Just doing it in the head is like trying to suck milkshake through a very long, thin straw. It's not going to make it. If you have a big tube, you can get it in there very much more. The other thing is the neck is we have all these lymph glands in the neck. And if we put the light on there, we can open up the drainage from the brain. Very important because it's all part of these small arteries up in the brain, and the perforating arteries, they have to push that fluid out through these perforating arteries to push it out through the cervical lymph nodes right there in the neck. Extremely important. So blood supply coming up to the brain, venous drainage, but also that lymphatic drainage of getting the waste products out. And that's why the neckWRAP was designed to increase blood flow to the brain. And that's really what it's all about.